First name is Alfred, last name Danielian, Alfred Danielian. I'm the director of sports cardiology and echocardiography at Las Vegas Heart Associates, an affiliate of Mountain View Hospital. I'm also a member of the ACC Sports Cardiology and Exercise Council, and also the incoming governor-elect for the American College of Cardiology chapter.
Perfect. All right. So talk to us about kind of the organizations that you represent in terms of sports. I see the Golden Knights behind you. I see you have some UNLV stuff behind you as well. So kind of take us through that timeline of your work.
Sure. So yeah, I have the incredible privilege of caring for all the unbelievable organizations here in town, the professional athletes and the collegiate athletes. The team cardiologist for the Golden Knights, for the Raiders, the Aces, Henderson Silver Knights, the UNLV Athletics, and also the Aviators.
What is it like working for all these organizations? I'm sure they all present their own unique things that come with the job. So kind of what can you tell us about working for these various places?
Yeah, the organizations are truly first class, unbelievable organizations that really value athletes' health and safety, number one. And as a sports cardiologist, my role is really to help screen for potential underlying cardiac issues in our athletes. Once identified, to help guide their return to play considerations, and also really to go ahead and use shared decision making involving the athlete, the team, all the stakeholders, the organization, to ensure that we're focusing on health and safety and long-term care for our athletes.
What is it like talking to an athlete about their heart health?
Yeah, I tell you, athletes are extremely intelligent. They are very aware of their bodies. They really want to make sure they're safe and healthy. And so they really understand if there is truly an underlying disease that we've discovered, they understand what risk they may potentially be at. And these are not just quick office visits or discussions as to this is what's going on. It's truly a long process, repeated process, multiple visits, multiple discussions about the athlete when we actually do have an underlying genetic disease or acquired disease that's been discovered, where we really talk to them about their risks of continued participation, and to really help, again, protect their health over the long term.
Um, in terms of our younger athletes, sometimes things go unnoticed. And the way things become noticed is through physical exams. You have to get physicals in order to play. At least that's when I was playing, that's how it usually went. Kind of talk to us about your work with our youth sports and our high schools and around the valley, and how you've been an instrumental part to get people the help.
Yeah, thank you. So what we really do is we try to identify any underlying disorder that may be inherited in our young athletes that would potentially increase their risk of sudden cardiac arrest during competitive sports. And so what we do is we really start with like a pre-participation athletic screening process that involves a very detailed history, a detailed physical exam, and a detailed family history. If we identify any abnormalities, any concerning red flags, I would call it, in that process, and that would then prompt further advanced testing, such as electrocardiography or imaging. And our goal, again, is to try to mitigate any potential risk of sudden cardiac arrest in our youth athletes.
Um, what comes to mind are, two recent cases involving athletes and kind of the unknown heart conditions that we found out that they had. One of them was a youth flag football player over at Desert Oasis, and the other one was, I believe, a UNLV football player too. Can you kind of talk about those cases in a general sense?
Absolutely. I'll tell you, very familiar with those cases, and especially Ashari Hughes' case, which was really the first one that happened shortly after the Damar Hamlin NFL player who played for the Buffalo Bills witnessed live on national TV having cardiac arrest. Ashari Hughes's cardiac arrest was very shortly thereafter, and it was those incidents that truly inspired me to try to extend the emergency preparedness that we have at the elite level, right, and the professional level to our community and beyond, actually. So that's what really kind of motivated me to have the opportunity to really push and advocate for what we call the Smart Heart Law, which we were able to pass unanimously in the House and the Senate. This was AB 454, which is Assembly Bill 454, again known as Nevada Smart Heart Law, which what we did was really ensure with this bill that AEDs were on site, readily available in all our Nevada schools for immediate use, ensuring CPR training was mandating in all of our coaches and staff, and making sure that we had emergency action plans in place that were rehearsed regularly, because these are the true ways of saving athletes' lives.
Um, we're doing a story right now about a young boy, middle schooler, who is battling the same heart condition as Shaquille O'Neal's son. Are you familiar with that, with his case? And
I am, yes. When he was part of the NBA G League Ignite team here, I was very familiar with it because I was also taking care of the G League Ignite team.
wow, that that is impressive. Uh, Juggling all those schedules that um,
Appreciate that. Thank
when
you.
you think about it though, with this specific case with this young basketball player, similar or the same condition as a pro athlete, what can you tell us about this condition that this kid is fighting, and just how the early detection is going to prove long term for him?
Yeah, absolutely. These coronary artery anomalies, which is what you're referring to, are honestly very difficult to diagnose on routine screening. And they're usually diagnosed by advanced imaging, which is why we really want to have a high index of suspicion. We want to ensure that we're doing a very detailed history physical exam, paying attention to any potential warning signs that an athlete, be it a middle schooler, high schooler, collegiate, or professional experience. Symptoms such as chest discomfort, especially on exertion, unusual shortness of breath, especially on exertion, or unexplained fainting. A lot of times we notice these are the symptoms that athletes experience. Unfortunately, though, sudden cardiac arrest oftentimes occurs without warning. And that's why the way to truly save lives is, again, those three pillars we mentioned: immediate AED use, CPR, and also ensuring we have an emergency action plan in place.
Awesome. Trying to think what else. What are some things that you are doing during Heart Month and that you've done in every single February, in the past to help get the word out about whether not just athlete screenings and sports stuff, but just the the call out just to the public in general?
Yeah, no, thank you for that opportunity to tell you what I've been doing, especially for the general public, because I think that's truly the most important. We start with the public. Um, I like to really say that there's three big things I remind the public regularly, especially during Heart Month. First and foremost is that heart disease is still the leading cause of death, and oftentimes it's silent. So most people usually feel fine until the first major cardiac event occurs. So we want to be very aggressive. We want to focus on prevention and early detection. That's the first point I tell them. The second that I've been really trying to instill is the fact that the basics truly work well. Those basics are regular physical activity, adhering to a heart healthy nutrition plan, controlling blood pressure, controlling blood glucose, controlling cholesterol levels, and avoiding smoking. Those are the most powerful tools we have to really prevent disease to our ability. And third, what I really try to talk to patients about, especially during Heart Month, is the fact that you really have to listen to your body. Be aware of any potential symptoms, any chest discomfort, unexplained shortness of breath, any unexplained fainting. Know your numbers, know your blood pressure, know your cholesterol levels, know your blood glucose, know all those things, know your family history as well. Those are really important points that really help us detect disease early instead of late.